So today we will talk about the pharmacological classification of drugs and with their doses and how they get prepared. Pharmacological classification ड्रग की देखेंगे आज, इनकी डोजेस देखेंगे और ये किस तरह प्रिपेयर की जाती हैं, इसके ऊपर हम बात करेंगे। हमारे पास गाइडलाइन जो है वो गाइडलाइन जो है केडी त्रिपाठी जिन्होंने जो एमडी किए हुए हैं, उनकी एक बुक है जेपी ब्रदर्स पब्लिशर्स के नाम से। तो उस बुक के फॉलो करते हुए हम जो है आज के टॉपिक्स को कवर करने की कोशिश करेंगे। ये कुछ की कंटेंट्स या की उसके आइडियाज हैं, तो इन तमाम जनरल आइडियाज को ऑनवर्ड लेकर चलते हुए अभी हम स्टार्ट करेंगे। जैसे कि हमें पता है कि हमारे फील्ड के अंदर जो भी ड्रग लिखी जाती हैं या कोई भी डॉक्टर प्रिस्क्रिप्शन लिखता है तो वो एब्रीवेशंस का बहुत ज़्यादा इस्तेमाल करता है। और वो एब्रीवेशंस जो है कुछ इस तरह होती हैं। लेट्स सपोज अगर कहीं पर भी रिटर्न में एएमपी मेंशन हो तो इट्स मीन that he or she is saying that this thing is need to be given in the ampule. Ampule you can understand कि इंजेक्शन फॉर्म के अंदर जो कि किसी भी जो है ग्लास के अंदर जो है होता है उसको एम्प्यूल का नाम दिया जाता है। एपी एक्शन पोटेंशियल जिसे कहते हैं कि यानी किसी भी एक्शन की वजह से जो रिस्पॉन्स आता है। बीडी यू नो वेरी वेल ट्वाइस अ डे, बीएचई बिनाइन हाइपरट्रॉफी ऑफ प्रोस्टेट ग्लैंड, बीपीएचपी कहते हैं बिनाइन प्रोस्टेट हाइपरट्रॉफी, और बीएचपी भी कहा जाता है। BSA mean body surface area, CAP stand for the capsule, CH child dose, CM centimeter, CR continuous release, and dispersible tablet जिसको हम DDT कहते हैं, और डबल स्ट्रेंथ DS सिंगल स्ट्रेंथ SS होता है, DS डबल स्ट्रेंथ होता है। इसी तरह DTPA डाई इथाइलिन ट्राइअमाइन पेंटाएसिटिक एसिड के एक मेडिसिन की जो है क्लासिफिकेशन है। जैसे हम पढ़ते हैं पीपीआई प्रोटॉन पंप इनहिबिटर्स, एसीई एंजियोटेंसिन कन्वर्टिंग एंजाइम्स, बीटा ब्लॉकर्स, तो इसी तरह डीटीपीए भी जो है ये एक क्लासिफिकेशन है। ओके, ईसी मींस एंटेरिक कोटेड। एंटेरिक कोटेड मींस आमतौर पर कोई भी टैबलेट जो है वो आप देखते होंगे कि मोस्ट प्रोबेबली रेड कलर में जो है उसकी कोटिंग होती है, लेकिन अगर उसको ब्रेक किया जाए तो अंदर से वो वाइट या जो है येलोइश कलर का पाउडर या जो है कलर होता है। तो वो जो कोट होता है बेसिकली वो स्वीट कोट होता है। वो स्वीट कोट इसलिए दिया जाता है ताकि जो भी पेशेंट है वो किसी भी टेबलेट को लेना चाह रहा है तो वो टेस्ट जो है वो उसका डिस्टर्ब ना हो या टेस्ट खराब ना हो। उस टेस्ट को मेंटेन करने के लिए जो है उसको कोटिंग दी जाती है। उस कोटिंग को जो है आमतौर पर एंटेरिक कोटिंग का नाम दिया जाता है। ER एक्सटेंडेड रिलीज कहते हैं, ERP इफेक्टिव रिफ्रैक्टरी पीरियड है। EXT इन एक्सटर्नल, G स्टैंड फॉर द ग्राम, GITS means gastrointestinal या gastrointestinal therapeutic system, HR stand for the arts, ID means intradermal, IM intramuscular, ING stand for the injection, IU mean international unit। जैसे कि हम किसी भी चीज की जो यूनिट का इस्तेमाल करते हैं, जैसे ग्राम है, मिलीग्राम है, सेंटीग्रेड है, फ़ारेनहाइट है, केल्विन है, तो इस यूनिट की आइडेंटिफिकेशन जो है एक स्टैंडर्ड ऑर्गेनाइजेशन के अंडर आती है। और उस स्टैंडर्ड ऑर्गेनाइजेशन को जो है इंटरनेशनल, वो एक इंटरनेशनली जो है एक यूनिट देता है जो कि ग्लोबली एक्सेप्टेबल होता है और पूरी दुनिया के अंदर उसको सिर्फ उसी नाम से जाना जाता है। सो दैट्स व्हाट इज नोन एज द इंटरनेशनल यूनिट। Then we have IV, that is stand for the intravenous, kg kilogram, L stand for the liter, and LES lower esophageal sphincter, जिससे कि it is a sort of valve, you can say. That valve is very helpful or fruitful for the maintaining your body system. Okay. Then we have LIQ, लाइकर भी कहते हैं इसे और लिक्विड भी कहा जाता है। That's mean related to लिक्विड। और एक और एब्रीवेशन यूज की जाती है, उसे AQ कहते हैं। AQ फुल फॉर्म इसकी ये है कि एक्विस। एक्विस का मतलब या मीनिंग ये होती है, इट इज रिलेटेड टू द वाटर, so means it's the same thing that is related to your context. Then we have the maximum MEX, और अगर min होगा तो minimum है, जैसे नीचे दिया हुआ है, लेकिन min minutes के लिए भी यूज होता है। अच्छा, मिली इक्विवेलेंट ये यूनिट है इक्विवेलेंट्स की, यानी माइक्रो इक्विवेलेंट्स, मिली इक्विवेलेंट्स, ये जब ड्रॉप फैक्टर्स वगैरह पढ़े जाते हैं तो मिली इक्विवेलेंट्स यूनिट्स की फॉर्म में जो है इंजेक्शंस वगैरह प्रोवाइड किए जाते हैं। MG स्टैंड फॉर द मिलीग्राम, MIN स्टैंड फॉर द मिनट्स, MR modified release, MU mega million unit or mega unit you can say, or molecular weight MW, and then we have the U shape that is known as the micro, that is the microgram. U जो है इसको हम जो है म्यू भी कहा जाता है और माइक्रोग्राम भी कहा जाता है। OD stand for the once a day, oint related to ointment, anything that is lubricated for the body and can apply to your tropical area to the skin. Then POT stand for the potassium, QID stand for the 4 times a day, RNA, rDNA, recombinant deoxyribonucleic acid, SC subcutaneous, SL sublingual, SOD sodium, SR sustained release, and suspension means the solution combination, anything. Then we have the syrup, when solute and solvent or solution combine with each other, that is known as the syrup. Then we have the tab form or tablet, and then we have the TCID, tissue culture infective dose, that is most probably given in the tissues to find that what type of pathogen or bacteria or microorganism is present. TDS stand for the thrice a day, THA, THFA, tetrahydrofolic acid. Hydrofolic acid means by which there are three atoms of water and follicle acids present with each other and having the bonding. Then we have the TTS, transdermal therapeutic system. Transdermal means any system that is under the skin. Okay, a question arises from here that here it's mentioned SYR, and mostly we observe that SYP as well. So both things are right, nothing is wrong, including SYR syrup or SYP syrup. Then we have the U stand for the unit. Unit, I already mentioned in the previous slide that one thing is the IU, that is the international unit, and second thing is the unit, or that is only U. Then we have the UV. UV rays most probably we experience in the areas, in the critical areas, most probably in the OT, ICU, CCU, and ERs. Whenever the person is crossing from the door, so just above the door there is a ultraviolet rays presence, by which rays a person uh, pass from the rays and get the disinfected from any external pathogens. Why are it related to age, hairs, and the longer lesion is also a part of this discussion. So this was the basics things, and in this all you can say the book, you will go through these all systems like drugs acting on the nervous system, auto autosphedic or related drugs like antagonist and hydroxypentadimine, and agonist, that is usually for the migraine and prostaglandin. Then we have the respiratory system, hormone related drugs. So here we have all the systems, and through this system we have to go through that what type of drugs we using in the, as we gone through in the last lecture, that in the autonomous nervous system, or we can say the central nervous system, we have the cholinergic and anticholinergic. Then cholinergic drugs divided into two major classification. Cholinergics, they let is cholinergic, and then we have the anticholinergic or anticholinesterase medicines. Cholinergic agonists are the medicine that work uh, cholinergic act or that stimulate the cholinesterase or anticholinesterase medicines are the medicines that work against the cholinesterase. And cholinesterase is one of the hormones that stimulate our you can say the neurotransmitters or that maintain the neurotransmitter in our body. With the cholinergic agonist means that maintain the cholinesterase, anticholinesterase medicines that work against the cholinesterase, and cholinesterase will maintain the you can say the neurotransmitter level. So when cholinergic agents working, it's mean the cholinesterase level is increasing. When anticholinesterase is working, it's mean the cholinesterase is eradicating or minimizing, and cholinesterase is not stimulating, and that will work as that neurotransmitter is also not working. This is some of the further classification, like cholinergic agonists have the choline esters, alkaloids, carbamates, acridine, carbamates, and organophosphate. These are the generic names that we usually see in our daily routines. So this is the combination that how these medicine combine. Let's suppose we talk about the betnacol or betnasol, we can say usually. So in the betnasol, that usually come 10 to 40 mg in between, and we use orally 2.5 to 5 mg, and most probably betnacol is used through the subcutaneous, or you can say. So it is a urotonin and bethacol. These are the names that we have in market. So it is a market name, you can say, or it is a name of trade. Then we have the piplacarpine. These are the things that we have in our market. So these are the medicine that act on the nervous system. Then we discussed mind in our previous lecture. Even we discussed about the mind, mind, and here we have a new thing that is a mind. So these all are the medicines that come in the market with the reference or with the umbrella of the nervous system, that whenever there is a nervous disorder, so these medicines will act. And along with that, it is mentioned here that let's suppose gastric mind come in the 0.5 to 1 milligram, and it is given 0.25 to 0.5% topically in eye. So this is you can say these are the eye drops, and maximum dose of this is 0.5%, you can say, or you can say that half of mg we can give through the, and there is a combination with the fluid. So you can say that whatever we require according to the doctor prescription, we have to give these all things. Then onward, if we talk about the anticholinergic agents, so there are the natural alkaloids, semi-synthetic derivative or derivations, or synthetic compounds. If we talk about the natural alkaloids, there is the atropine, iosine, that we usually use the atropine for the positive inotropic as well. And then we have the semi-synthetic derivative, which means that on one side there is a derivation from two of the medicine, it is combined, like atropine and methylnitrate. Then we have the hemotrophine, then we have the hyoscine butyl bromide, then we have the ipratropium bromide. In shortly, we will say IBM, ipratropium bromide. Then we have the tiotropium bromide, and in the synthetic compound, we have another classification, that is the anti-secretory, anti-spasmodic, and mydriatics, you can say, and vesicoco selective or anti-Parkinsonism that we use in the Parkinson's. And in the cholinergic or cholinesterase agents, anticholinesterase agents, we commonly use, you can say, the drugs that give the muscles activity, or that give the muscles, uh, you can say, that give a proper channel for the conduction of neurotransmitters by which the muscles can active or work properly. So these all things come under the nervous system. As we see here, that here a most important thing in that we studied in previous lecture, that Parkinson's. So here we have the drugs that we use against the Parkinson's, and whenever the patient is with the Parkinson's syndrome, so this can cause a positive act or effect on the patients or clients. I am receiving some chats. Voice is not clear. So from my side, I think so it's okay, or now it's going to be more better. If still you face any problem regarding the voice, you can still talk to me and you can share your text. So I will try to facilitate you in that way. Okay, so clear now. Good. So here we go. Uh, in the autonomic nervous system, we gone through in the previous slide that we have the atropine, that is also used as a positive inotropic as well, and this is, yeah, also in the injection form, and in the, let's say, the eye drops as well, eye ointment. Then we have the hyoscine hydrochloride, or especially we have the methonitrates in the form of atropine. Okay, so these are the medicines, or the names of the medicine that come under the anticholinesterase medicine. And the common thing, or common medicine that we use, is the atropine. Then we have the glycopropylate ipratropium bromide, that is used, IBM, and triopium or tetropium bromide, that we use for especially in inhalation. And it's a sort of, you can say, the nebulizer, or ipratropium bromide in the form of it come with the atom nab. These are also the, you can say, a sort of bronchodilator as well, and it work as a neurotransmitter. Okay, then we have the ganglionic stimulator, or you can say the ganglion blocking agent. As we know, the ganglion is as a part of, you can say, the neurons that helpful, or that is useful for the transmission of the channel, or for the transmission of you can say, for the transmission of message and the neurotransmitter. So if the ganglion is superly activated, so the transmission is quite easier. Than the ganglion is blocking, then it's have an impact on the body. How it get prepared? So this is a combination or preparation elements, that how many elements or compounds combine with each other, then it will get converted into the, we can say, the neurotransmitters, or we can say the drugs that is useful for the central nervous system. The students who are facing with their cameras, or they have open their cameras, I humbly request to all of them, kindly switch off your cameras, and if your mic is unmuted, kindly do mute your mic as well, because I'm just receiving. Okay, so okay, then we have the adrenergic drugs. You can say the drugs that work as the adrenaline, or drugs with working with your all neurotransmitters. So these are the drugs by which we have the commonly salmeterol or salbutamol, or there is another that is the dopamine and the salbutamol. So these all the drugs that are the adrenergic drugs that stimulate your sympathetic system, and it control your body activities. Okay, uh, if the student still facing the voice problem, so kindly do text me. I just received a text that there is a voice problem, and I do humbly request to Mr. I think it's Shafiq. So kindly switch off your camera, please. So that as we discussed in the previous slides, that in the ANS or autonomic nervous system, there is a major thing is the adrenaline, or we can say the adrenaline or positive inotropic in the form of adrenaline, dopamine, and salbutamol. So these how it get into we can say with which name that come in the market. So it is actually the epinephrine, but it come with the name of the adrenaline. So adrena is also a name of a you can say a vial or injection that come in the form of adrenaline. So then we have the non-adrenaline or norepinephrine, you can say, and levotrienol as well. So NORAD, we usually say the NORAP as well, and NORAD as well. So these all things come under the same.